Hi guys, welcome to my channel. Today we're going to be talking about toothpastes. Now there's lots of different toothpastes on the market, lots of different brands, and saying they do all these different things. So I'm just going to tell you what to look for in the most basic toothpastes. The main ingredient in toothpaste is something called fluoride. And fluoride occurs naturally in water, in rocks, in tea and in food. Sometimes it's added to the water depending which part of the world you're from. What fluoride does is it gets absorbed into the teeth and it helps keep the teeth strong against the acid from bacteria. It helps replenish the calcium and the phosphates inside the teeth. So we do need fluoride in our toothpastes. There's different levels of fluoride that you need to look for depending on the age of yourself and your children. And all the information that I'm going to be giving you is from an article called Delivering Better Oral Health, which is linked in the description below. In children, you want to be giving them fluoride so that as the teeth are developing, the fluoride can be incorporated into the teeth and be strong. The fluoride in toothpaste is quantified in parts per million of fluoride, or ppm, and it's on the back of the toothpaste. The back of the toothpaste can be quite small, but what you're looking for, it's usually in brackets and it's got a number and it says ppm FL. In children 0 to 3, you're looking for less than 1000 ppm of fluoride. And you're only wanting to put a little smear on the toothpaste, you don't want a lot. 3 to 6, you're looking for about 1000 or a little bit more ppm, and you go for a pea-size amount, which is a little bit more than a smear. And then 7 plus, you're looking for 1350 to 1450 parts per million, which is what an adult needs as well. You can get toothpaste which you've got characters on like Paw Patrol or princesses or Disney or anything like that, and they actually have the sufficient amount of fluoride in for an adult. So if your child has issues with mint flavours, things like that, then you can get the child one. Just make sure you have a quick check on the back. Now for those children who are at high risk of getting decay or they have special needs, they are in a higher risk category. And so what we recommend for those children is that they actually have a little bit more fluoride to help combat any issues. For adults, you're looking between 1350 to 1450. Most of the big brands like your Colgate, your Fresh, anything like that have the right amount of fluoride in, unless it says fluoride free on the packet. If you are a high risk adult or you have special needs or you have a lot of sugar in your diet, that sort of thing, then you can be given a high fluoride toothpaste by your dentist, and you have to get a prescription. You can't buy that over the counter. The most common one is called Durafat. The Durafat comes in 2800 parts per million or 5000 parts per million. So quite a few people suffer with sensitivity. It's sometimes also called dentine hypersensitivity. And what happens is you have the top layer of your teeth, which are your enamel, and under that you have dentine. Now the dentine is made up of tiny little holes. And what can happen is if the enamel is worn away through excess brushing, a lot of acid in your diet, things like that, then the dentine is exposed, and that's what's the sensitive bit. There's lots of different sensitive toothpaste out there and they all do something a little bit different. Unfortunately, we don't really know what type of sensitivity you've got unless we take your tooth out and put it under a microscope, which obviously we're not going to do. So the advice is to try one type of toothpaste, and if it doesn't work, after 6 to 8 weeks, try a different type. There's two main ways that the toothpaste can help with sensitivity. What it does is you've got your tubule like this and it puts a barrier on it like that so the air can't get to it. The other one is that it builds up a barrier from the base of the tubule up to the top. As soon as you stop using these toothpastes, the sensitivity can come back quite quickly because you've not got that barrier. So if you find a toothpaste that works, just carry on using it. 3 of the toothpastes which I usually recommend are Sensodyne Repair and Protect, Sensodyne Pro Enamel, and Colgate Sensitive Pro Relief. As I say, there's lots of different brands out there and you just sort of have to find the one which works for you. Another thing which helps is before you go to bed at night, get a little bit of toothpaste on your finger of the sensitive toothpaste and rub it on the area that's sensitive. And what that does is it gives time overnight for the fluoride and the ingredients to be absorbed into the teeth. The most important thing that you need to remember is not to rinse out after you've brushed your teeth. You need to let the fluoride be absorbed into the teeth, and that can take up to 30 minutes. So once you finish brushing your teeth, spit any excess toothpaste out and leave the toothpaste on the teeth. Don't rinse with mouthwash or water, you're just washing the fluoride off. It's like if you have hand cream on and wash your hands, it's not doing what it needs to do. That's it really for toothpaste. Just make sure you're looking at the back of the packet and getting the right fluoride levels for the age of yourself and your children. So hit the like button guys and the subscribe button so you know when I post a future video, and I hope you'll have a nice day. Bye!